Hello and welcome to the latest in our autumn series of Bristol University Press webinars. I'm Catherine King, Marketing Manager, and I'm delighted to introduce our speakers, Gemma Carney and Paul Nash, authors of Critical Questions for Ageing Societies, which published last month. They've also produced some online resources for the book, which you can see in the chat function. Gemma is a critical gerontologist and senior lecturer in social policy and ageing at Queen's University Belfast. Paul is a chartered psychologist and associate professor in the Leonard Davis School of Gerontology at the University of Southern California and is joining us very early in the morning, so thanks very much, Paul. Gemma and Paul will talk for 15 minutes and then I'll put your questions to them, so please use the Q&A function at the bottom of your screen. If you have any technical issues, please use the chat. Details of how to order the book at 50% discount will also be available here. I'm now going to hand over to Gemma and Paul.
Thank you very much, Catherine. Thank you very much to everyone at the Bristol University Press, and thank you very much for everyone turning up both in the UK and in the US. So I'm going to get the awkward bits over and done with to start with, a little bit of product placement here. As you can see, there's going to be a nice product placement throughout the whole of the talk as well, so you can see the cover of the book. But really, we came to writing this as a bit of a change of ethos. What we wanted was to produce a book that was accessible for students, could be a learning resource for faculty, but also was accessible for people of a lay audience as well. So what we tried to do was focus each of the chapters around questions that had been asked to us by students and questions that we thought bridged all of the facets of gerontology. So we've got aspects of politics, of economics, of sociology, of psychology, of biology. Basically, we've tried to cover everything, but we've done it in a way that is quite applied as well, and is applied to an international market. As mentioned, I'm obviously in California and Gemma is in Ireland. We've tried to make sure that we've used examples from different areas around the world, so that, again, it is more wide-reaching. But we wanted to make sure, as I mentioned, that it is a teaching accessible book. So what we've tried to do is to use examples, and we've tried to use learning resources as well as teaching resources that are both available in the book and as part of our online compendium as well. Really, what we've learned from writing this book is there are certain things that we have as taken for granted assumptions within society. So basically ageism. We have tried to put across within the book the rich depth within the aging population. So looking at the heterogeneity. And one of the major aspects that we've drawn from this that's applicable to COVID-19 is where ageism is so prevalent. And we've also, within the book, developed what we've called the AIR model of ageism, which is the acquisition, internalization, and reinforcement model of ageism. Here we have looked at how ageism is acquired across the life course, what happens in later life when those stereotypes are internalized, and how the reinforcement of that impacts both older adults and younger people, both in terms of physical consequences for older adults, but also in terms of the acquisition formats for younger generations, and what the overall impacts of those can be in terms of policy, where we've seen ageist policy around COVID-19, but also where we look at how older adults are treated and victimized within society, as seen as, for example, in the US, where the narrative has been, well, the economy is failing because we're protecting older people. So we look at how those narratives have developed within COVID-19, and again, how the textbook can be applied. Each of those lessons can be applied within this very, very specific context. So I'm going to pass on over to Gemma, who's going to apply this aspect of social ageism and talk to you about some of the research work, the fantastic research work that's been done by her and colleagues in Ireland.
Thanks very much, Paul. Good afternoon, everyone, and thanks for tuning in. I really enjoyed working with Paul on this book, and now that the pandemic has hit, I'm even more convinced that it was worth all of the work. There's so much information out there around COVID-19 that sometimes it all just starts to sound like noise. And I think books like ours are really showing how important they are in this day and age because they're educational. Their whole purpose is to convert information into knowledge and to convince people that social issues, like aging, are important, they're worth thinking about, questioning, and ultimately improving in terms of policy decisions. So basically what I'm going to try and convince you is that by reading this book, you're going to be able to get your head around the pandemic. The very first chapter of the book, we deal with demography, which is the structure of the population in the area where you live. So if you were to look at demography when you're trying to, say, get a policy response to COVID-19, you would immediately see how the structure of your population is really going to affect what you need to do. So if I took the example of Western Africa has not been through the demographic transition. They still have a system which is a population which is in a stage of high fertility, high mortality. So there's lots and lots of children and young people, not so many older people, and people die younger. In a country like Sierra Leone, you'll see from chapter 1 of our book, the life expectancy is only 52. Now, how is that going to affect COVID? Well, it becomes really apparent when you look at Western Europe. In Western Europe, we have a very different population structure. We have been through the demographic transition, so we have fewer children, more older people. So instead of having a pyramid shape, we have kind of a long, slim population pyramid that extends up at the top, because what that shows is that there's more people who are living up to, say, 100 or more. But of course, what's happened now with the pandemic is that it is those people who are really at risk, those people at the top of the population pyramid. And say in my area, in Northern Ireland, 80% of the excess deaths in the first month of the pandemic were people aged over 75. And it's not just about having more older people, it's also the health of those older people. So in Western European countries, we have some problems, and particularly this applies to the UK, with things like obesity, diabetes, and these are all the things that make treating COVID-19 much more complicated. So demography matters. When you're analysing excess deaths during a pandemic, being aware of the demography of your population, the age structure of the place where you live, it gives you great insight into how you can design policy to respond to the pandemic. And because I study aging and have just published a book on it, everybody's asking me, why are older people more likely to die of coronavirus than other groups? And I really think the best way to explain this is really to look more closely at, how older people live. And this is something that you'll learn from the book, particularly our chapter on care. Because when people reach kind of over 80s and they end up needing to get a little bit of help, a little bit of frailty sets in, and that is, there are biological reasons for that. And we cover that in the book. So it isn't just that you're sick. Actually, when you're older, you become more frail. And then when people have, so say, mobility or frailty issues, and they end up living in a nursing home, they actually then are much more vulnerable to dying from COVID-19, not so much because of their age, but because of where they are living. I have heard some researchers, such as Konecka in the University of Chicago, talk about how the pandemic represents a perfect storm because of three different things, really. It's a perfect storm in terms of the dreadful deaths we've had in care homes, I mean. So the nature of the disease itself, it's very contagious, it's easily passed. We have asymptomatic individuals, and it really is passed on in badly ventilated indoor settings. The way we provide elder care as well, not on an individual basis, but in big communal settings. And because we have, where we have for-profit systems, where people are trying to make this form of care pay for a company, then what we have is a ratio with staff that really isn't good enough. We also don't pay the staff well enough, and so they might end up having to work for an agency and have a number of different jobs. And that all increases the traffic in and out of care homes. And of course, then the risk. The other thing is, of course, if people have dementia or other issues, physical distancing is virtually impossible. There are other issues that we cover in the book, and many of them come back to that central core conceptual contribution that the book makes that Paul referred to, which is the model that he came up with and that I helped develop, which is this AIR model. And this really needs to frame how we understand, all of the responses that we've had around the pandemic, particularly when it comes to older people. But it's the diversity of that older population. It's the way gender inequality plays out in older age. It's where politics comes into play and how we value older people. All of these things are really starting to become so horribly apparent during the pandemic. So I can give you an example of age blindness, kind of turning a blind eye to older people. That's been a big, big problem. In fact, it's the biggest single cause of the excess deaths in the UK over the last few months. And that was our government decided that they wanted to send out the message to protect the NHS, save lives and stay at home. But actually, in protecting the NHS, the National Health Service, what they did was they moved many older people who were in hospital out into care homes. But they didn't protect the care homes. In fact, they were forgotten about. So in many ways, they placed those older people into danger. And of the 30,500 older people who died in those settings, actually only 10,000 had a valid COVID test that was positive. So actually what happened was these people died of their other issues. So that's really age discrimination in healthcare, which I'm sad to say is really well established in the literature, and we cover that in the book. The other thing that you could look at in terms of the pandemic is the treatment of all the other older people. So the people who are healthy but in their 70s, and they're all told to stay at home as well. And they're really, the message is very clear that you are taking a risk if you go out, that if you get COVID-19, you're likely to die. That is not actually the case. In fact, it's an 8% rate. So in fact, most people over 80 who get COVID-19 are going to survive. It is really about those underlying conditions that I mentioned at the start and the health of our older population. So really what we're doing there is using age in a kind of a way where we're socially constructing it as problematic. And in many ways, that kind of buys time for governments. And this is where politics comes in. Because if you think about it, those most vulnerable, frail older people, they don't vote. The children who've been excluded from school don't vote. Those frail older people in homes, they're cared for by women who are often migrants, they're on low pay, and all of these people are really easy for politicians to forget. And what we often also forget is another group that has been really badly affected in terms of deaths from COVID or excess deaths during the pandemic are carers in homes. So even though they're doing their absolute best, they are not being protected by the state. So what I'd really like to do is to get our policymakers to read Critical Questions for Ageing Societies and to really think, right, how could they make better policies? It's understandable what happened at the start of the pandemic. Nobody knew about this disease, but we know, we have some information now. Like one of the things we know is that the rate of infection in the local area is the most accurate predictor of deaths in a particular care home. So that means that you've got to have, my policy would be, what I would recommend from what I know about aging, is that they need to have a zero tolerance approach to COVID-19 in care homes. We need to really, and that might mean that the staff need to live in for a while, or that's where we really need to concentrate our efforts. And the pandemic has shown us that you cannot have a good healthcare system without looking after your older people, without a properly funded social care system, for instance, without being aware that you have an aging population. So if social care was integrated into the national health system, then we would protect the NHS, but we would also protect older people and people in care homes at the same time. And I hope that this realization is the policy legacy of the pandemic. So that's what I wanted to say, Paul.
Well, as always, Gemma, you say things with such eloquence that very few other people could add extra to it.
Thank you very much, both of you. And now we've got some time for some questions. So please do enter your questions in the Q&A function at the bottom of the screen. I've got a couple to kick us off that have come in. One question says, what underlying attitudes in society do you think have led to older people, particularly in care homes, being neglected by policymakers during the pandemic?
I wouldn't mind elaborating on that one, which is, the more I think about this, and it has bothered me, I think anybody in gerontology has found the last 6 months utterly depressing, because to be honest, we have been ranting on about social care for the last 20 years, and it's been a political football. And the reason it's been a political football, and nobody has really, taken it on and sorted it out and properly funded it. Basically, the policy now needs to match what our demography is. And what's happened is, of course, we haven't actually changed the policy. So we're still, providing critical care when actually people have chronic conditions and people need somewhere to live where they can be supported. We haven't done the things that we need to do. And that's because those people don't have voting power. So my hope is that, you know, the families of older people, or those of us who are at the age where we still have time to have things improved by the time we get there, is that we start to really advocate for that change. But I do think that issue of the social care proving to be, it's almost like, what's that saying, you know, the tail wagging the dog, is that the social care being such a problem in the pandemic, that I think it's showing that what looks like a good NHS is actually really much fuller than we thought, because we haven't got anywhere safe and good enough for people to go to recover, you know. So I'm hoping that will be enough to say, well, if another pandemic comes, we better be better prepared. So we need to sort this out.
And just as one very quick addition to that, I think one of the major issues is the lack of knowledge and the lack of education. Everyone thinks they know about aging. Everyone thinks that they have a tacit understanding of what it is, but gerontology is a relatively young science. And unfortunately, many people make assumptions about older adults without engaging them in that conversation, or indeed about making these decisions based on their own stereotypes. And again, that's what we talk about in our model, in our book, on page 29, when you want to buy that. But it's just a way of saying, well, yes, we do need to make sure we are looking at these institutional and these systemic changes. But one of the reasons, or one of the ways we need to make this change, is through education.
And this is why I've been doing more cultural gerontology as well, because, and there's a whole chapter on that as well, because actually I'm starting, the longer I spend researching aging, the more I think is the people whose minds we need to change are ourselves. So the more that we kind of explore and understand what it means to live a long life and how valuable that is, that then, you know, that comes across, particularly when you live in a democracy.
Absolutely. Thank you very much. Moving on to another question from Nora Keating, who says the WHO Decade of Healthy Aging has as a priority action developing a global campaign to combat ageism. What lessons can we take from the pandemic to inform such an agenda?
Paul?
Go first.
Thank you very much, Nora. I think in terms of this, again, what we need to do is we need to make sure that we are not making these assumptions about groups. I think based on the way in which countries around the world have victimized older adults and have used stereotypes about aging and frailty, and how poorly that has worked out both for older adults themselves and for the wider communities, both in terms of social isolation, in terms of loneliness, and in terms of increasing the spread of COVID-19, I think it only goes to underscore the fact that we need to look at this from an evidence base, rather than engaging in stereotype behavior. And that really underscores and highlights exactly what the WHO are saying. So their global campaign to end and combat ageism is really founded on and based in the fact that we need to present counter-stereotypical images and counter-stereotypical messages that aren't inaccurate, but indeed actually get us to reassess our own stereotypic attributes for this older population.
Yeah, and I'd like to ask that, because I've had a minute to think, which is that there's the chapter in the book that Paul led on, which was diversity. I think that's a really important chapter. And I think that is I'm hoping that is one of the things that's going to come out of the pandemic, is that we now understand not all older people are the same. And I think that needs to be, because that's one of the big problems with ageism, of course. You stereotype, you put everybody into one category. So I'm hoping that the diversity of the older population will come across.
Absolutely. So going back to the comments about care homes and so on, Bridget Penhale says, would you like to say anything about ageism, elder abuse and the pandemic? For example, care homes restricting visits, etc., for protection may lead to abuse.
Gosh, I know Bridget's work well, and I really admire it. I've been reading it recently. I've been working on a chapter on elder abuse, actually, with Lorna Montgomery as a social worker. And the things that we don't actually deal with elder abuse in much detail in the book, because we're not social workers, and we thought we were better at talking about the societal ageism. But what's really struck me when I started looking at it with Lorna, and some of the things that the book pulls on very well, is around that social construction, and particularly around treating people as if they are, zombies who are all the same. And when you see really you could argue, you really could argue that it is mass elder abuse, what is happening with the neglect of older people who are dying in care homes, and also with the sense that you're throwing so many people. There's been a lot of coverage I've been doing media analysis research at the moment. There's been a lot of coverage around domestic violence and the dangers of people being stuck in their homes during the lockdown, but nothing really much on elder abuse. Where and that is ageism, because we don't see it as serious because it's happening to an older person.
Yeah, Bridget replies, actually, social construction is very important here, and as ageism is as somehow permissive of elder abuse. Paul, did you want to add anything?
Yeah, and I think it goes on really to say, building from what Bridget has said, and indeed on the work that she's done in the UK and that Kate Wilbur and her team have done in the US, is looking at the span of elder abuse. So we talk about elder abuse, but similarly, that isn't a isn't a homogenous category either. So elder abuse goes everything through from physical abuse that we could talk about, say there's obviously been hidden behind doors, same as we've seen as an increase within the adult population, all the way through from enforced social isolation, which is elder abuse. No other age group has had the same social restrictions mandated on them that older adults have done for their own benefit. Yet we all know the dangers of social isolation and loneliness. So I think that what we look at here is how dangerous ageism is in terms of applying what we know best for an older population.
Yes, and picking up the social isolation point, Andy Sage says the UK government has repeatedly reported that there's a shortage of retirement housing, yet social housing providers are failing to step up to meet the demand, instead leaving it to the private sector. Are these homes needed, or are there better ways to meet the housing needs of older people?
That's a hard one. I mean, basically, it's a bit like I was saying earlier about how the policy hasn't caught up with the demographic change. And like one of the big problems with private housing markets is that they're built on the basis that you're going to kind of turn a profit. And so they go for kind of an average house that suits, a 2.4 family. And then you have whole swathes of the country that don't have suitable housing at the right budget for people. So I have heard of some really innovative pilots, but I haven't seen it rolled out, of kind of intergenerational living of people. There was a pilot in Ireland of people getting grants to, say, if you have a big house with 2 stories, that you convert it so the bottom story is for you, and then you rent out the top space. And that would have the great thing of course, having a bit of intergenerational living. And if you're interested in the politics of aging, actually, Maggie Kuhn, who set up the Grey Panthers, which was a great civil rights organization that was based on intergenerational solidarity, she started that after she retired, and she took in some younger lodgers, and she realized that younger and older people had a lot in common in terms of the civil rights. So actually, housing is a much bigger issue, and it's not done enough by gerontologists, actually. But it's a massive issue. Yeah, good question.
Yeah. And I think, just to echo what Gemma said on that, is similar to what we see within the aging population, is we need to look at that heterogeneity in housing provision. So it's not a case of one size is going to ever fit all. And rather than saying, well, we need to put all of our eggs in one basket with the village model or with an extra care model, for example, what we need to do is actually provide a range of housing solutions, including aging in place. So I know there's a lot of work in Swansea University that's been going on in aging in place, also looking at Robin Means, and the work that's been happening across the UK and within the BSG has been fantastic on housing. But I think one of the takeaways from that is we can't do a one size fits all. And that's become incredibly apparent when I've moved over to the US.
Yes. And so in a related question, Glenda Doherty asks, are there concerned that these stereotypes and assumptions about COVID and older people are actually increasing fear of going out and social isolation among older people?
Absolutely. And, I've been doing this little research project since I finished the book around COVID, and I haven't been doing direct research with older people, but I have been studying some of the letters that they've written to newspapers, because I've been doing a media analysis. And one of the things we found is, in fact, I entitled the working paper that I published, Caged and Forgotten. That's how they describe it. So in fact, I thought when I was reading these letters, they were going to be about older people, being scared. But in fact, what they are is saying, you know, and initially, yeah, it's scary, but in fact, what I am is I'm more afraid of what I'm missing out on. I'm missing my freedom so much. And I thought what was amazing was that from right across the political spectrum, so like the Guardian and the Telegraph, they both had readers writing in about how frustrated they were. And there was quite a bit of solidarity towards the older people. So these are healthy older people in their 70s and 80s writing in, but they do speak up on behalf of their peers who are, you know, more vulnerable because they have dementia or they're in a care home or whatever, and talk about how that lack of testing. So yes, there is evidence. That's something that I would love to research further. But I do think that a lot of the issues that we cover in the book, particularly around, you know, social construction, that social science perspective, understanding that having an aging population is more than just having more older people, that it's a different population, that's actually key to understanding all of these issues.
Yeah, and again, that's underscored with the diversity chapter as well. So slightly on a tangent, but some of the work I do in California is with older adults with HIV. And when been working with that population recently, they've stipulated that in the 80s, they were forgotten because they were HIV positive and they were discriminated against, and the stigma that was associated with that. Now they're undergoing a double stigma because they are older during COVID-19, where they're being isolated and forgotten and discriminated against. So what we see, older adults who again aren't having that particular voice, aren't having their voices heard. And it is increasing that level of social isolation, both in terms of that internalizing their own self-worth from the continual political narrative, but also in terms of how other people are working with or treating or even ignoring this social group.
Absolutely. So moving from sort of focusing on people in care homes to thinking about older workers' experiences, Catherine Elliott O'Dare says, have you any thoughts or insights around older workers' experiences during COVID-19?
Well, I really enjoyed doing that chapter in the book about older workers and employment. And one of the things that I found was that there was kind of two strands of research that we drew out that were really interesting, and they both apply to the pandemic as well, of course. And one of them was around people having encore careers, so people going and retraining as apprentices or whatever during you know, instead of retiring, they decide that they're going to retrain. So you can imagine that all of that is up in the air now. So there's massive implications for people who are trying to start another career, as many of us do now because we live longer and we don't have such good retirement savings. So that's a big issue. So all of the issues that you hear about for younger people, which are completely valid for younger people around training and education, but if you're an older person trying to get back in, those problems will also apply. Then there's the people who are, you know, facing that cliff edge of retirement. And there was a really interesting piece of work done on Canadian physicians who refused to retire. And the reason they refused to retire, when you looked into it, was because they had such demanding careers that they didn't have any kind of social life around their careers. And this was a really big problem for them. So you can imagine, for people facing retirement at the moment, so not only are they going to be, you know, missing all of that social contact, they're missing that nice finishing off of work, and they're facing into becoming into this category of the over 70s, you know, if they're 67 or 68 now. So of course, COVID makes everything harder. But I think that anybody who's trying to transition in and out of the workplace and doing it as an older worker or doing it as a person who's about to retire, it's just everything's made that bit more difficult.
Absolutely. Paul, did you want to add any comments?
No, I think with that one, Gemma's basically said everything and then some.
Great. Well, I think we've got time for just one more question, and I'm very sorry if I didn't ask all the questions that people would put forward. But this one's from Bernie Graham, and it's about looking forward. She says, what would your recommendations be for the next 6 months of COVID-19? I hear there's a conflict of views among SAGE and other experts between letting the virus rip, so to speak, with hope of achieving herd immunity, moot point, but while doing so effectively, locking up the most at-risk groups, which sounds like shielding plus. So what would your, have you got any?
It's a really hard call, but I think if I was in charge, I would really focus in on the settings. So rather than having it about age, So I'd focus in on the people who are, you know, genuinely at risk medically, so whatever age they are. And I'd really focus in on the settings like the hospitals and the care homes, and I would put all my resources into keeping COVID out of those. Because really, you know, taking children out of school, you know, because there's a whole chapter on intergenerational solidarity. And really the way we look at it is that wherever you are now in your life, whatever age you are, you're at a life stage. You know, you're not going to be there forever. So whatever you do with children now, that's going to have a real impact on them in old age. So we need to think much more laterally, but we also know a bit now. So we know a bit more about how to treat it. We know that most of the deaths happened in those settings, so we need to work on those settings. So that's what I would do. I don't sign up at all to this, you know, Barrington Declaration of making some people stay in all the time. What I would instead say is that, you know, the testing system and all of that all needs to be focused in around the most at risk people and the most at risk settings. That's what I'd do if I was in charge, but unfortunately I'm not. Paul.
Paul, and your views about what will be coming in the next 6 months?
Well, obviously, we're looking at it from a slightly larger situation. So I know, for example, in California, the level of testing has been exponentially increased. We're one of the largest testers anywhere in the world. And we're one of the few states that are seeing a stabilization or decrease in the number of cases, whereas other states and indeed around Europe, there's a big increase. I personally look towards great examples like New Zealand and say, well, okay, you've got a period of 2 weeks of incubation, and that might be 2 weeks worth of hardship, but you look at the successes that they've had for increased testing, increased almost ring isolation that they did in New Zealand, and you see now they are out enjoying life. And I think that there are lessons to be learned from places that have had these successes.
Success, yes,
Absolutely.
Well, thank you very much for joining us today at this Bristol University Press webinar, and also to our speakers, Gemma and Paul. Details of how to order the book at 50% discount are available in the chat. We're developing our spring programme of webinars, and the next one will be in January on policing in a pandemic, with others to follow. Please see our social media or website for details. Thank you.